So I've asked you questions. I'm going to give you the answers. And this is the third time I'm recording it because I keep reading out people's names who ask me the questions. And I don't want you to get in trouble. So there you go again. I was about to say the name. All right. Do you need insulin to maximize HGH effects, or can you just use it alone? No, you don't need insulin. From a therapeutic point of view, very few people develop even pre-diabetes or degree of insulin resistance on HGH unless you're using prolonged periods of high doses, and then in your 40s, 50s, then you may look to do something to help with your sugar levels. But when we're talking about putting on muscle, that's a different story. I can't really answer that. What's a safe zone for TRT dosing? The only really safe zone that's been studied is sort of up to 200 milligrams a week from what I can remember. And even then, that's done for a year or so. But TRT within the normal range is safe. Am I going to use TRT my whole life? As I get older, I will have even more reason to need testosterone. I can't really see a point where after being on for 10 years that I would want to come off and rely on these tiny, tiny, tiny nuts. I've just started a test cycle. What should I do in terms of healthcare? Just get your blood work done, get your blood pressure done. And if you can't get bloods, then buy them yourself. It's funny I have to say that some doctors don't do your bloods. Beta blockers necessary at 300 to 500 milligrams? No, that will cause more harm than good. And it's certainly not the first agent that you would use for high blood pressure. When is it not TRT? Hearing guys say they're on 200 milligrams for replacement at 35 years old. Surely that's just a cycle. For most people, it will be a cycle. I guess the idea of a cycle is you come off, right? Can steroids or testosterone help me lose weight? There was a recent study done, and patients who replaced their low testosterone and also used Ozempic lost almost double the weight. So it's pretty comparable. 48 years old, best stack to build muscle on a lean man. I'm not answering that one. What are the biggest mistakes you see people doing, which should be general knowledge in this industry? Probably overusing estrogen blockers, running Nolvadex long term, overusing Kaba, just an ancillary stuff, right? Because that's really where things get tricky. Using blood pressure medication when you don't need it. Using blood pressure medication with diuretics and causing acute kidney failure. Using a lot of orals in the off season. That's a dumb idea. Thoughts on more frequent pinning, even just off cycle? TRT. The more the better. Do you have any colleagues in Australia that you could recommend? No, I don't. There's probably a lot more options out there in Australia. I think doctors over there are a bit more agreeable to, looking after you while you do whatever you're doing. But it is a battle. Is it true that HCG can't be prescribed to males under no circumstances in New Zealand? Yes, it's not available here. And that I don't really see when it will. How would you go about getting steroids for sports and training in New Zealand? You can't. No. But you can go get cannabis. If more HGH does not increase IGF-1, does it still have any benefits for muscle growth? I'm not answering that one. You're in New Zealand. Are there similar mind doctors in Melbourne? Nearly impossible to get bloods. It's interesting that guys in Australia have the same issue. What's the time frame for staying on TRT and not being able to come off to reproduce? I guess by that, do you mean becoming difficult to come off? It varies for many people. Some people can run TRT for 3 months and then they have a real hard time coming off, particularly with the mood and the energy levels. But some people come off after 3 months, they feel fine. There's really no consistent pattern. How long can you truly run Anavar for? I hear 6 to 8 weeks, then I've heard as long as 5 months. That's a tricky question. It's pretty toxic. It's bad for your cholesterol, like comparatively with other compounds. So obviously I can't answer that question, but 5 months is pretty crazy. If you're prone to gyno, are you just doomed? I've tried every combination of stuff. Here are the 2 reasons guys get gyno. It's because they either use nandrolones or they come off and then the test and estrogen is imbalanced. And so you get sort of an elevated estrogen as you're coming off, and then the testosterone drops. The other causes would be people on finasteride. It greatly increases your risk of gyno. But by and large, the top cause of gyno for bodybuilders is generally NPP, DECA, and TREN. Is it still possible to have children if you've done roughly 5 16-week cycles? Sorry, man, I don't think this is for you. That's a silly question. What would dictate doing a sub-Q test injection versus intramuscular? Is it dose size? Subcutaneous injections, generally you don't want to go over 0.3 mils, but really there's no reason to go subcutaneous. You just cause a bit of local inflammation, particularly the compounds like ones we have here that are prescribed, like Sustanon from Pfizer. Yeah, it doesn't make much sense. What's your favorite part of your job? It's a tough job. And I struggle to find my favorite part of it, because a lot of it is just disappointment, and it's really an uphill battle trying to be an advocate for this area. I get a lot of pushback. Can finasteride impact libido and erections? If yes, why? Is it permanent? It absolutely can, and the information you'll receive is that a small percentage of people will get side effects, but the reality is if you're reducing your DHT, you're going to get a degree of reduced sexual function. That happens for most people. And if you stop it, you'll notice that actually that it comes back. People talk about post-finasteride syndrome. Usually there's something else going on. Is it possible, if you reduce DHT for a long time, that it permanently becomes downregulated? I'm not the right person to answer that, but generally, the people that have had post-finasteride syndrome also dabbled with testosterone and things, so I think there's other hormones at play. But yeah. Is it normal to not get morning wood? My test and estrogen are optimized, but I never wake up with it. It's not normal, and your testosterone and estrogen are probably not optimized. Your estrogen is either very low or very high. So you need to look into that. Or it's prolactin. Approaching GP for a full hormone check. You are bound by the rules of our funded healthcare system. So if you're just getting a screen of your hormones, you should probably pay for that yourself. But if you need healthcare or you've got symptoms of hormone deficiency, you should qualify for that. Looking to start a 250 test cycle at age 20. Would appreciate any advice. Man, 20 years old. Aren't you still growing? This is why I am passionate about this, because, oh man, when I was 20, it's just a different world now. My TRT dose stays the same, but the acne keeps flaring up, then going away. It's probably related to your dosing schedule. Try everyday administration and you might notice that it'll start to get better. To lower estrogen, is 1 milligram of Arimidex once a week enough? I can't answer that question. Like, what's your estrogen? What's your test dose? If these are the questions that you're asking, you need proper guidance, and it's probably not for you what you're doing, because how do you lower estrogen if you don't even know what your estrogen is? That's when people run into trouble, and they have the estrogen low for many years. Myself, as a doctor who has been in this stuff for many years, still struggle with figuring this stuff out. How do you go about asking your GP for steroid-related blood work? It's a common theme. Honestly, I don't know. I was in the same situation many years ago. Is finasteride good for battling hair loss, and what's its cons while on the cycle? What's its cons? Reduced sex drive, fatigue, can cause brain fog, increases your risk of gyno, does help with prostate health long term. But yeah, it all depends, man. How much do you like your hair? Why does the word testosterone almost seem taboo? I'm talking about nearly every doctor I've seen. Yeah, it's a good question. I think its association with bodybuilding doesn't help. But, we should all be allowed to receive adequate medical support in whatever we're doing. And if we have genuine testosterone deficiencies, we should also have access to treatment. We shouldn't have these guidelines where GPs are told, if you've never prescribed testosterone before, then don't do it. That's exactly what it says. Is there any explanation as to why GPs are very reluctant on doing 6 monthly full hormone screens? Because Why should you get free full hormone screens? Like, go pay for it yourself. Do you like it when I flick the tongue? That was my girlfriend. Is injection site rotation important for long-term lifetime TRT use? Will it affect absorption? It's just you're just going to develop scar tissue if you don't rotate the site. Will that affect absorption? Probably not significantly at all. Some people have a favorite spot, and generally I'd say avoid shoulders in places that you can see, especially if you're using underground stuff. You don't even know what's in it, and you get an infection, and then you have to get you have to get it drained, and then you have a big scar. That's probably all I can be bothered answering at the moment. Pretty similar themes, really. A lot of people are just disappointed, I guess, that they feel a bit lost with their support around their health, which is a shame. A lot of young people here wanting to start testosterone. Bye-bye.